So today we're lucky that Franka Cadée, the president of the International Confederation of Midwives, has joined us just ahead of the International Day of the Midwife and in the year of the nurse and the midwife. And we really want to talk to her about what midwives are going through right now and what's important to them and the services that are really crucial to continue in the middle of a pandemic. So thanks for joining us, Franka.
Sure.
So this year is as I just said, the year of the nurse and the midwife, and the day of the midwife is May 5th. How are things different?
Well, things are extremely different and in many ways also very much the same. Of course, COVID-19 has really changed the face of things and how we're all behaving with each other. But those women who were pregnant are still giving birth. They're still giving birth in the same way. Women are still getting pregnant. As a matter of fact, I've even heard that with people staying home a lot, people are getting pregnant even more. So that is also changing. So on the one hand, I think things have really changed, but we must also realize that on the other hand, we're also just carrying on with life, and getting pregnant and giving birth is part of that.
Okay, great. Yeah. So in the middle of something like this, what is the importance of a midwife to continue that healthy outcomes for women and children? And do you feel like there's an increased importance placed on midwives? And what are the challenges that you're hearing from the field?
Well, what we're hearing is actually very, very worrying, because somehow, there is still a lot of work to be done concerning making sure that women give birth well and safely and securely worldwide. We are in many ways very much behind with the SDGs. But somehow, now that COVID has started, a lot of the attention is going to COVID-19, which I can very much understand. Yet at the same time, as I said before, women are still giving birth, which is an incredible experience to your life. It's a life-changing experience, and important that it goes well. And midwives are needed right there with women. And I think in many ways even more so, because women are quite worried. They're worried about what the consequences are. They're worried about their babies. And at the same time, midwives and resources, and sometimes even buildings, are being pulled away from midwives. So we see wards worldwide where women give birth made into COVID wards. We see antenatal care being taken away and done by phone, which again, I can understand, but it does have consequences, because this is not care that is not needed. We need to build a trusting relationship with women, and it's difficult to build that in that way. And women need care during birth, and we see quite a lot of circumstances where women have to give birth alone. So the midwife is with the woman, but a partner or a sister or a mother or whoever in a culture would be with a woman while she gives birth is not allowed to be there with her. We hear a lot of disrespect. So I'm actually extremely worried about what is happening, because women are still giving birth, and they're giving birth to the future.
And so what are you advocating for right now? What do midwives need right now more than ever in the face of this sort of adversity?
I think that we need more resources right now, more resources to make sure that we can do our work well and safely, so that we can safeguard the future. Because all the children being born now are our future generations, and we need to, especially in a time like now, invest in our future generations. So midwives need personal protective equipment. I think that's one thing that's been a big issue, whereby a lot of it has gone towards nursing and medical aid and not to midwives. But midwives, of course, work very closely with women, and we have to protect women, and we have to protect midwives and their babies. And so they need personal protective equipment and the right size. Interestingly, what we see is that a lot of personal protective equipment has been ordered, but for the size of a man. And midwives are women generally. And so sometimes it just simply doesn't fit. But we're lucky to even have it. Many places we don't have it. And I think in general, the focus is so much going towards COVID-19 that birth is being seen more by women as something they're worried about. And I so wish that women can feel the beauty of giving birth, and not only make it more into a big, fearful experience, which it is not. And it really is having huge effect on midwives, because midwives need to support women more than ever now. They really need to build trust and to be able to hear the right information. And at the same time, we're not always able to be with women because we're either being pulled away or we don't have protective equipment or not the ways in which we can actually support women at this time. It's really extremely worrying.
Yeah, I mean, you saw from the perspective of the United States, there were, a lot of the, like you were saying, it's changing in terms of how pregnant women are getting their health care, and then the rules and regulations are changing. I know that there was a bit of a turn towards midwives and maybe even midwives being overburdened with cases.
Yes. In the US, I think you'll see that because in the US, birth is very much institutionalized. And some women might be worried about going into an institution. And so sometimes you see midwives as being those people who work independently outside the hospital. I would actually personally recommend for women to give birth in that place where they can give birth securely. And I can understand why women are worried about going into institutions. But at the same time, not all countries are geared towards safe home birth. And in the Netherlands, that's very, very where I come from. That's very possible because we have a very, very safe system where giving birth at home is a norm, and the system is made such that is fine. But it's not like that everywhere. But you do see some women move away from hospitals, very understandably, because they're worried that they'll get sick in a hospital. And actually, hospitals are for sick people. Maybe we should start rethinking.
That is what's kind of interesting, that you can somewhat see some, in a time of crisis, see some rethinking and innovating and maybe a turn towards a better in some ways. And so kind of getting back to that that positive feeling, that, sort of transformative feeling that you can have around a birth. What's your advice to women who are pregnant right now, advice to midwives? How do you find that in the midst of this?
I think it is important that women feel that they are welcome with their questions and to reach out. Even if you can't see a midwife face to face, getting on the telephone or doing, Zoom calls like we're doing now, we can see each other. I think that is a way too, that a midwife and a woman can speak to each other. And that can be done in many countries because actually quite a lot of people do have a mobile phone. And in some countries, it might be the man of the household, but possibly there could be ways in which she could see her midwife, because nearly all midwives worldwide will have a cell phone and will be able to do this. And I think the building of a relationship of trust really is the essence. We know that when there's kind of continuity of care, so a woman builds that relationship and she knows what she can expect, she knows she'll get quality care, she knows when she can reach out, that actually makes the chances of her having a safe, secure birth that she feels pleased about, that she can build on and that her child can build on is much bigger. And again, I just so hope that women can hang on to the special part of giving birth. Interestingly, in certain Western countries, it's also doing good things because, sometimes when women have given birth and they go back home, they're overwhelmed with visitors. And all you do really is just receive visitors, and it doesn't do much good with your breastfeeding, and you're very, very tired. And actually, COVID is making that women at times have to stay home alone with their families, and they create these little kind of nests where they don't have many visitors and can have rest and peace to get used to the young child and get used to the other children to get used to it and to be able to sleep. So actually, I'm also hearing some positive stories. I'm also hearing that breastfeeding in some places is working very well. In hospitals where there's not visitors all the time and women are still in hospital after having given birth, they have some more time. And there's not all this kind of time pressure because they don't have anything else or anyone else. And supposedly it does good things for breastfeeding. That too should make us think.
Yeah, it's really good to always find that the positive.
Yeah, it is.
Yeah. So ahead of the Day of the Midwife, what kind of resources do you have? Our audience are, communication professionals. Are there any tools that you guys are putting out, or any sort of messaging you're amplifying, or?
Yeah. Well, basically, we're celebrating midwives with women and saying our time is now. And I think COVID is showing it more than ever. Our time is now for women and midwives to stand together. Actually, our only reason for being is being with women. And yes, we do have some advocacy toolkits. You can go onto the ICM website, and on there you'll find a toolkit for the International Day of the Midwife. In many ways, the International Day of the Midwife this year is quite special because midwives are quite warm, huggy kinds of people. They like getting together in big groups and really dancing and celebrating, and we can't do that this year. But we're also very innovative. So I think that we're no less not pessimistic because of it, and are really, I think, finding ways in which we can enjoy doing this together. But we can also see that, this year is also the year of the midwife and the nurse. And for us, this is the first year of the decade of the midwife. Every day is the day of the midwife, and we need to make sure that we deliver for 2030 when the SDGs are done, and we still have so much to do. So there's plenty of time to celebrate and plenty of time to work hard to make that we really believe in happen. And I do believe the theme of this year being with women. I think we really need to go hand in hand with women, and we need to make sure that women are at the table, midwives are at the table where decisions are made, that we advise the health ministers about midwifery, that we are in government, that we are in the boards of hospitals, and let our voices be heard. Both women and midwives need to be there, and we know that when that happens, actually things work much better. Things work well because we understand midwifery, and that is very much the theme of the 5th of May. But it's actually also the theme for our next 10 years to go, that we really, really want to support midwives to make sure that they're heard at the decision table.
Great. Yeah. I mean, important messages about, building back better once we get beyond this too, is that link from governments and policymakers to those on the ground and those who really know and are linked in with the local community and especially midwives. So thank you.
Interestingly, what I find is that it's often said that midwives are not empowered, and that we need to do all kinds of things to empower midwives. I don't agree at all. I think midwives are extremely powerful. Midwives are able to make all kinds of decisions at crucial life-changing events. We are deeply empowered. Empowerment is not the issue. The issue is that we need to be listened to. People need to dare to listen to our messages, which are not always the easy ones. We can be critical. We can be a little bit radical sometimes, midwives. But I think that what we need is that people dare to hear what we have to say. I think it's worthwhile. It really is worthwhile.
Well, thank you so much for joining us. ICM is very lucky to have such a great leader in you. And thanks for taking the time, and good luck.
Thank you so much. Thank you so much. And I look forward to carrying on.